Welcome, everyone. We are glad to have you here today for All Hands on Deck. We are just going to give it another minute while we get everyone joining before we get started. Make sure everyone's audio gets connected and can get logged in before we have our session today. Got a bunch of people that are excited to hear about all the different data today is what it looks like. Oh, there's Jenny. I see Jenny now. I was keeping my eyes peeled. Got one more coming and then we'll get them and get started here.
Hey guys, how are you?
Hi, Pam. How are you?
I'm good. I miss y'all.
We're glad to have you here.
I've got my sidekick too.
Yes, Joy's here too.
Hi, Joy and Pam.
Our quiet people in Kansas.
How's it going?
Great.
Are we the only ones that have joined you guys so far?
No, we have 45 other people on.
Oh,
but it's all about you, Pam. It's all about you.
Pam and Joy just can't see it all. We love you guys, though. All right, I do think we have a pretty good group going right now, so we will get started. So welcome everyone today. Thanks for joining us for our All Hands on Deck call. We are glad to have you all here, and we are super excited to hear about some data and some research that we have been lucky enough to be part of with some new partners and friends of ours that we have. We have Kim, Jenny, and Deirdre with us today, and I'm just going to turn it over to them and let them run the show. We are going to have time for questions at the end, so if you want to put those in the chat as a holding place, or just know that there'll be some time at the end that we can go over some questions with them. So thanks, you guys. I'll turn it over to you.
All right. Hi, everyone. Thank you for attending today. As Carrie said, I'm Deirdre Colburn. I am at the Crimes Against Children Research Center at the University of New Hampshire. My colleagues, Kim Mitchell and Jennifer O'Brien. Kim is also in New Hampshire. She's a little under the weather, so I'm going to try to do most of the speaking for her, but you'll hear from her in a little bit. And Jenny, I don't know if you want to introduce yourself.
Sure. Sorry, it took me a minute to unmute there. My name is Jennifer O'Brien. I'm an associate professor in the School of Social Work at the University of Texas at Arlington, and was formerly at the University of New Hampshire and worked closely with Deirdre and Kim at the Crimes Against Children Research Center.
Perfect. Thank you. So as Carrie said, today we are presenting some new research findings to help enhance the community response to drug endangered children. Right. So a little bit of background about the Crimes Against Children Research Center, or the CCRC. We are, again, at the University of New Hampshire. We were founded in the late 90s to study, traditional child victimization. We have since expanded to study a variety of topics, including self-directed violence and bystander response, commercial sexual exploitation of children, hate crimes, gun violence, substance use and exposure, help seeking, technology, and others. We have conducted several large national studies, including the National Juvenile Online Victimization Study, the National Survey of Children's Exposure to Violence, the Youth Internet Safety Survey, and Project Lift Up is one of our large ongoing longitudinal studies right now. And we're supported by a variety of funders, including the National Institutes of Health, the National Institute of Justice, and the Centers for Disease Control and Prevention. So jumping right into the study that we were talking about today, we collected pilot data to help inform a grant proposal that we submitted to NIH earlier this month. So we are calling this the Growing Up with Opioids Study, or Growing Up, OPE, Growing Up for short. This is an online survey of adults aged 18 to 60, recruited through ads on Facebook and Instagram. Data for the study were collected between March and July of this past year. And respondents were from across the United States. We asked a variety of questions about their experiences with victimization, adversity, and whether they lived with someone who struggled with drugs or alcohol when they were growing up. So this was a retrospective study. And among those who said that they did live with someone who struggled with drugs or alcohol, we then asked a variety of follow-up questions about their experiences. We recruited over 1,500 adults to participate in our study. Our sample was mostly white cisgender women. The mean age of our sample was 33 years. About 20% of our sample identified as a gender minority and nearly half identified as a sexual minority. That is common for what we see with online social media samples. We tend to have larger proportions of sexual or gender minority respondents. 30% currently live in a rural area in the US, and 32% are parents themselves now. So about 37% of our sample reported growing up in a household where someone struggled with drugs or alcohol. 55.7% reported living with one person who struggled, and about 30% reported two people, and then 5% of our sample reported living with three or more people growing up who struggled with drugs or alcohol. We asked them to identify their relationship to these people. Most were biological mothers or biological fathers at 40 and 57%. And stepfathers, brothers, and their mother's partner were also the three next most common relationships they identified. So we asked respondents to think about, if they reported more than one person, who was the person that they were closest to of these two or three that struggled with drugs or alcohol while growing up. About 75% identified their caregiver, so this would be mother, father, stepmother, stepfather. Fewer said that they were closest to their sibling, a friend, or another family member who struggled with drugs or alcohol. When asked about the substances that this person struggled with, the most commonly reported substance was alcohol at 83%. These are not mutually exclusive categories, so a lot of them checked more than one. Followed by marijuana at about 33%, prescription pills, cocaine or crack, sedatives, stimulants, hallucinogens, THC products, and then the lowest frequency was heroin or fentanyl at 4.5%.
So we did ask participants to tell us just in a few sentences how they had become aware of this person's substance or alcohol use. The majority of folks said that they had witnessed some kind of substance use in the home, potentially that folks had told them about it. Many had used with this person. People talked about abnormal non-aggressive behavior, things like being drunk or high, maybe staggering on their feet, and then as well as aggressive behavior, things like violence, fighting, and different forms of abuse. Many noted that the person was absent from the home in their life, particularly around caregiving. Financial issues. Some folks noted that they hadn't known that there was substance use until there was an overdose. And then the outside institutions had become involved. Most folks noted that they had become aware of the problem under 12 years of age, so very young. About 19% said 13 to 15 years, and then these smaller pieces of this pie right here are 16 and up. So people noted becoming aware quite young. Next slide. These are just a few of the quotes from the sentences that people wrote into the open-ended responses. And so these really reflect some of the overarching themes that I just went over. So one person said that the person that they knew had become aware after they went to rehab when I was 7, after trying to overdose in front of me. Watching my 70-year-old father bawl in desperation because the prescription for oxycodone ran out 4 days before the pharmacy was able to refill it. They were a different, unhappy, snappy person in the evenings. She only spanked me once, and it was when she was drunk and she doesn't remember. The SWAT team kicked down our front door, arrested my parents for drug possession and the intent to distribute. So while these are sort of more extreme examples, they reflect sort of the broader themes that we had talked about before. So maybe not being aware until there had been some sort of system involvement. I don't want to give the impression all of these folks had SWAT teams knocking down their door, but certainly many did talk about, there being some sort of larger legal or system involvement before they became aware. Next slide. These are just a few more quotes. I started learning about alcohol in school and realized that he was abusing it. This was also a fairly common theme, people becoming more aware of substance use, many times through school and then applying that to home. She overdosed and died. I had no idea that there was a problem. Passed out, dirty house, no food. This is a very common theme. Folks recognizing that person not being present in the home, not being able to get up, being passed out, not having things that are needed, excessive fighting between my parents, getting a DUI, driving me while drunk, not going places because they didn't sell alcohol, or were too far to drink and drive without getting caught. So lots of things in this quote. Again, the things that I would say came up again and again in those quotes were those things like excessive fighting or violence within the home that seemed to only occur when there were substances involved, oftentimes some kind of a DUI or that system involvement, and then being limited somehow in terms of what they could do outside of the home without substances being involved. Next slide. So we did ask also indicators of the problematic use. So we asked, if individuals continued to use even when, and then gave a variety of sort of negative repercussions. It's important to mention that many folks responded not sure. About between 20 and 30% responded that they weren't sure. So it's quite possible that these numbers are actually a bit higher than what we're seeing here. So this is the percentage of the people who responded. So just something important to note. But we can see here that the things that are coming up most frequently are causing problems at work, home, or school, causing arguments with family and friends, causing health problems, and getting in physical fights. And then at about 20% and lower, we have these last four: going to the ER, fire department, and or ambulance came, overdose, or arrested is kind of sitting right about 35%. So these are the things that the kids or our respondents noted that they had done to try and help the individual in their lives that was using substances. Some noted attending AA meetings, driving them to appointments. So lots of trying to facilitate more formal help seeking. That's how this sort of quote would have been coded. My mom often said she wanted to quit, and I tried to be the person to support that. Speak up and went to local counselors, but I was told that that didn't happen here, so I quit speaking up. There was a lot of themes around asking for help, being denied, and then sort of stopping, trying to facilitate help among the kids in our sample. Once when I was little, I was on a camping trip with my father and I poured out all of his beers. So this was also a very common theme where kids were trying to get rid of the substance, either pouring out things or flushing things down the toilet, hiding things, giving them to other people to take away, that sort of thing. Next slide. Similar things here. I tried talking her, gave her a DARE pamphlet, prayed for her. As I grew older, I attended some addiction recovery groups in support of her and drove her to an inpatient detox when her alcoholism was causing seizures and extreme emotional upheavals. So what we see in some of the quotes like this one is that education about what substance use was often facilitated by school, sometimes other after-school programming, and kids trying to connect with those folks around their parents' substance use or their caregiver's substance use. And the people in those programming essentially responding in ways indicating that they weren't kind of equipped to actually help with substance use happening in the home, right? So an outreach for help that was then kind of not able to be met. And then they're kind of being, for kids, sometimes shame, sometimes confusion. A lot of times, like, if this person can't help me, who am I supposed to go to? Just not really kind of knowing where to go, what the next step would look like. I told him how I felt and wrote him a letter explaining the harms he did. Lots of emotional appeals appeared in the qualitative results. I tried to do things they couldn't when in that state so that they wouldn't get hurt, such as preparing meals. I didn't try and help them, but another adult spoke with them and realized that they were getting addicted. So some parentification ideas would have been how this was coded. Wasn't my idea. Mom would make me beg him to stop trying to guilt trip. He'd agree, never follow through. I blame my mom for putting me in that position. So again, this is kind of that emotional appeal piece. Next slide. So just a few more different ways folks tried to help: being supportive, talking to her when she's sober, yelling, begging, trying to remove her triggers. Nothing worked. I was 13. I asked my dad for help, but he refused. I asked my parents' pastor for help. He refused to. Nobody helped me. So from the age of 13 onward, I had no help for her drinking and physical abuse. I tried to be seen and not heard, tried to help pick up the pieces as best I could, tried to be the absolute best I could be so that my dad would be proud of me and my mom would not worry. So again, we see these really age-appropriate methods of asking for help that are then sort of thwarted, either because the systems that had been appealed to were not able to help, or sometimes because of the emotional capabilities of the individuals that they were asking for help from. We did see a lot of parentification and sort of children trying to take on additional roles to protect parents and keep them safe. Next slide.
All right. So we also included a question that asked respondents to answer, thinking back on their experience growing up, how did it affect their life? Most reported significant life effect, with about 40% saying that they still feel the effects of this experience today. And given our samples 18 to 60, that's quite a significant impact. And in contrast, less than 2% said that it had little effect on their life. We also asked about various victimization experiences that occurred during childhood and compared how these were endorsed by those who grew up in a household with drugs or alcohol versus those who did not. So those who lived with someone who had problems with substances were more than twice as likely, in some cases more than twice as likely, to report each item related to each of these items related to child neglect. 80% of those who grew up in a drug-affected household reported experiencing any forms of child neglect. And they were also much more likely to report sexual abuse experiences. Nearly 40% of drug endangered children reported sexual abuse, compared to less than 20% of those without this experience. And they were also more likely to report experiencing or witnessing physical abuse. Over 80% of the drug endangered children in our sample reported any physical abuse exposure. And a similar pattern was seen with emotional abuse. So nearly all, 91% of the drug endangered children in our sample reported experiencing emotional abuse during childhood. And emotional abuse notably was also pretty high among those without this experience as well, at about 72%. When asked about different forms of childhood adversity, we also saw higher rates among the drug endangered children compared to those who did not grow up in a household with drugs or alcohol. And these are some of the additional forms of adversity we asked about here. And some additional forms here. Notably, almost half reported witnessing a drug deal, and about 40% saw an arrest take place in their home or in their neighborhood. Pass this over to Kim.
Yeah, but there's also a large research literature out there that suggests that the more victimization and types of victimization and the more non-victimization adversity, the worse outcomes as they get older. And the drug endangered children in our sample had experienced, when we count all of those things up, significantly more different types of victimization and more different types of adversity than the participants who had not grown up under these circumstances. And you can see it's quite a big difference there. Switch slides. Sorry. Great. We also found strong links between growing up in a home with problematic drug and alcohol use and different types of youth problematic behavior that they reported was going on at the same time. So these are some of the things that we asked about: running away from home, staying out late at night without permission, using drugs, drinking alcohol, skipping or ditching school, being kicked out of their home. These kids were over 2 times more likely to have experienced and done these things while they were growing up. And I'm sure not surprising to many of you on the call, the participants who had grown up under these circumstances were over 3 times more likely to have been involved with Child Protective Services and almost 3 times more likely to have been involved with foster care. We also saw increased likelihood of more internalizing mental health challenges. So, and these are lifetime rates, but the drug endangered participants were almost 2 times more likely to have had suicidal thoughts, or 2 times more likely to have actually made a suicide plan, and 2 times more likely to have actually attempted to die by suicide. So we're seeing both the kind of externalizing delinquent type behavior as well as the internalizing. We also asked several questions about help seeking for different types of reasons, and we just compared, as you can see now here, between the drug endangered and the not, and we're seeing that the drug endangered children were more likely to seek help for mental health, different physical health reasons, sexual health reasons, housing needs, food needs, and also their own substance use. We also asked them, for those who had sought help, where, because we were really curious about kind of what resources they were looking at. So we saw a lot of what we call informal help seeking. So these are things like looking for information online, going to their friends, both their friends they know in person and also their friends they know online. Some were going to helplines like 988 or 911, but we did actually see some other more formal resources, use of resources like therapists, teachers at school, particularly around when they were looking for help for mental health, and parents and or other caregivers.
So at this point, our hope was to facilitate a bit of conversation with you all. Of course, we're happy to answer questions you have about any of our results or any of the information that we've shared today, but we'd also just love to hear your thoughts on some of what we found. And learn from you about other things that might be helpful to know that maybe we haven't covered yet or we weren't able to cover on today's call.
You are welcome to unmute and ask your questions. You can type them in the chat if you're more comfortable doing that, whatever way works for everyone. While you're maybe thinking and processing what that question might be, I liked to point out that alcohol was the most common substance that was misused, that was impacting these children. That's a legal substance. And so that's part of what our definition is, that we're talking about legal and illegal substances. And I think that just really goes to that we need to continue the efforts that we're doing and talking about that, because whether it's legal or not, it is impacting these children for the negative a lot of the times. And so we want to be able to continue to address that.
Hi, yeah, I'm Kelly from Michigan, and out of our coalition, which included our Drug Endangered Children's Alliance, we have formed a Drug Endangered Children's Alliance work group, and we are trying to start a collaborative effort. So it's baby steps, and I would like to be able to use some of this information to inform that group as we move forward to try and come up with a strategy that we might be able to use in our community. Is that possible?
Absolutely. Yeah. We're happy to share the whole slide deck.
Wonderful. That would be wonderful.
And we also have a number of, kind of easy fact sheets that we've put together. Some of them I know that we've shared with Carrie and her team and have been on social media. So we are happy to share this slide deck, and it has more detailed information. But if something like a pamphlet or kind of something that would be very easily digestible and shareable would be useful, we also have some materials like that we'd be happy to share. And again, if there's other things that would be helpful to share in different ways, we're very open to that. Exactly what you're talking about, Kelly, is I think what we're hoping to do to be able to share this better. We'll get it back to
Great.
you, please.
Thank you.
Carlton, I see your hand up. Carlton is our board president currently here at National DEC.
Thank you very much. First and foremost, I just want to say thank you for this work and this information. It is extraordinary, and I think extraordinarily valuable for all of us in the capacities in which we're trying to serve children. I have two questions. I came on maybe a couple of minutes late, and so I may have missed what made up the survey, the sample. And so I was just curious as to the age range of those that were surveyed for this. And then secondly, what might be some of the broader implications that might be that you may have gleaned in your kind of gathering and collecting this information for our alliances? I'm just curious as to, you guys have been working with this data for some time. What are some of your thoughts about the potential broader implications for trying to serve these children better? Thank you.
You want me to answer that, Deirdre? So the participants were 18 and older. They actually range from 18 to 60 with an average age of 33. And so we asked questions, all these questions about things they experienced prior to the age of 18. And then we actually have a number of other questions that we didn't include here about how they're doing now as well. But I mean, I think one of the implications that from this data is there seems to be so many different points of potential identification and intervention with these kids. I do a lot of research on bystander behavior, and kids talk to other kids. And on that help seeking slide, that they're going to their friends, they're going online for help and support. And, I think the help seeking and receipt and trying to learn more about what are the signs that kids are trying to give us without, in the best way that they can, in safe ways, I think.
One of the things that stood out to me, and I'll end with this, is the slides in which you were sharing some of the comments by the children or by the young people. They're not children, but the young people that participated, indicating how often they sought help in the various ways in which they sought help, but the help was not identified or overtly denied. And just that one broke my heart. But secondly, it just re-incentivized kind of what is it that we're here trying to do and what we're trying to work towards. And so thank you. This was really, really profoundly useful information. Truly appreciate it.
Dr. Jill, I see your hand has been up.
Hello, everyone. Yeah, thank you for allowing me to speak. I'm a pediatrician in Oregon, and Carlton, I wanted to mention the same thing you observed. Like that broke my heart when they reached out continually and didn't get that. And that is precisely the work that I'm doing here in Oregon in regards to substance use prevention, right? And really working upwards. And I also really resonated with one of the last slides about who were those people that they reached out to, and to teach those people what a critical role they play in these children's lives. And so the whole HOPE initiative, or the positive childhood experiences model, of really telling adults in our communities how important they are in the structure of our communities, to reach out and identify these kids earlier at a time when we're losing resources in so many valuable ways, with federal dollars being reallocated and so forth. So thank you so much. This data is going to help me do a lot of good work here in Oregon. I really appreciate your time and sharing this with me.
Tabitha, your turn.
Oh,
Yeah, I would love.
Oh,
quickly.
sorry. Oh,
Sorry.
Jenny had something. Sorry.
Yeah. I just wanted to, I think build on what Jill and Carlton had said, and then also kind of what Kim had said, and just say that one of the things that we noticed, especially about kind of the help seeking in with a lot of kids, is that when systems did step in, that a lot of kind of that the kids are maybe not always the trauma of that whole process on the children, especially for kids who had no idea, right? So there were certainly some kids who didn't know, and then there was an overdose, or there was a system that became involved, and it was sort of a surprise that's extremely traumatic. And so oftentimes that not necessarily being a part of that conversation, of the shock and the role that systems can play, I think, in even just acknowledging the disruption in the midst of that help that they're providing, that there's also trauma in that helping process and that growth process, particularly when kids didn't know otherwise. So that is maybe not in the quotes that we shared, but certainly is in the tenor of the overall comments that were left by participants.
Thanks, Jenny. Tabitha.
Yeah, first and foremost, I'd like to thank you all for the time and effort that you put into obtaining this survey information. And I want to ask, one of the questions is, how do you feel, what was your success for this? Do you think it was because it was an online survey? I know you had several people. I don't know if you mentioned, or I know Carrie mentioned last night, the number of participants that were included in this. And do you credit that to it being like there it is. Who did we talk to? Yeah, what do you credit that to? Because I mean, that is a large sampling of people to participate in a survey. So I wanted to ask that question. And also, did they talk about, was any question in there about their socioeconomic status as a child? Not now, but as a child. Because, coming from prevention, that would be one of the things that I'd like to share. There's no, it's not just the poor children or the ones living, and the King subdivision or the highest class subdivision in the communities, that just happens to be called Kings Ridge in my community. But with that being said, is there any, did you all ask that question? And one of the other things that touched on me, coming from a prevention background, was the one child that said that they brought in the DARE pamphlet or the DARE information. And that, another critical piece to me is why we have to continue doing prevention efforts in our schools. But thank you all again.
You're welcome. So first question is how we get the size of the sample. We do a lot of research with vulnerable, hard to reach populations. So we have perfected this methodology of recruiting participants, and we recruit kids online too, and high risk kids. And, we do it through engaging advertisements. And it's a fairly, relatively easy way actually to get a large sample in a fairly short period of time. We didn't set any quotas for this. So some of our other research is more diverse, but we didn't have a lot of money for this one. So Yeah, I think it's just the methodology we use. If we were going to do some other ways, it would certainly take longer. And then so we have a number of questions. Actually, we did not include them here for time reasons, but we did ask about different social and structural determinants of health while they were growing up, which touches on what you were mentioning. So we have questions about food insecurity, not having enough money to pay bills, kind of their home living conditions. So whether there were bugs, mold, their neighborhood conditions. And let's see, what else did we ask? But along those lines. So we certainly have that, and it is certainly related to and higher among these kids that are growing up in these households. And I forgot the third comment.
No, I was just commenting on the one comment about the DARE pamphlet, the
Oh,
child
right.
that had brought home the DARE pamphlet,
Right.
and how important it is that we continue prevention efforts in our schools and our communities, because that was, at least that child saw that resource and, brought it into the family to try and provide some sort of support. And hopefully that prevention program impacted that child's life.
Yeah, I was struck just reading through the kind of qualitative open ends that Jenny was talking about, and even more of them, how many said, oh, I learned this at school. I found out about this at school. And then they were applying it to their own situation. Yeah, I totally agree. It's really important. Because for many of these kids, that's how we're going to reach them.
Mhm. I know a little more history behind all of this. The survey could take up to 30 minutes to complete, and so obviously we're being shared just a small snapshot of all the information that they were able to collect and gather and hone in. All of the different comments and examples that children and youth were writing in and adding into that really helped show some of that impact. And I think some of those comments are ways that we can use that information and go, okay, we are making a difference through DARE programs and prevention efforts, or here's where maybe we're missing the mark and that there's a gap here, and how can we, as those service providers and people that are going to be those systems that are intervening in children's lives, what could we do different, or how could we help sooner and better? And so being able to recognize that, because one of the questions did talk about, were systems involved in your life, and which systems were involved. And so that's something that's helpful to all of us, of like, if we are involved, are we doing the right things, and are we approaching it from the right way and the right angle that is providing the help that we want to do? That's why we're all working in these fields, is we want to provide help, but is it being received in the way that that it's intended? And so some of that information was really valuable through this study also.
One of the other things I wanted to mention, that we had a number of questions in the survey, which we didn't present here, that focused on their own strengths, right? So much of the research is on the negative and the risk and the risk. And I think we know a lot about that, but I think what would be really helpful moving forward is how to identify different strengths and resiliency within the person, their relationships, and the community that helps them thrive, even despite these sort of experiences. And so we looked at things like stress coping, so how they adapt to change, dealing with what comes to them, being able to bounce back after hard times, recover quickly after a stressful event, self-mastery, and things like that. And I can tell you, we've been digging into that a little bit. And if you take the two groups of kids that really grew up with a lot of adversity, a lot of victimization, grew up in drug endangered families, we found one group that had a lot of these strengths and the other one that had none. And then when you look at their current adult outcomes, mental health, the group with the strengths is doing so much better. So I think that's something else we can learn from. Like, are there some things in some of these strengths that we can help teach them in terms of, handling different situations and stuff?
Yes, I'm very excited for that
Yeah.
part. Carlton, please.
Yeah, thank you. And both of you kind of really excited me with your comments around this, because that's exactly where I was kind of thinking about this. Because as you were talking, one of the things that really stood out to me in the conversation. Like, there's a great deal of work on and research on literature on the impact of protective factors, and there's a good bit of science now that they talk about in terms of mattering,
Yep.
in terms of when children feel seen and valued, that they matter to the appropriate or attached adults or the systems in their lives, that is a huge protective factor with respect to whatever context or environment that they are in. And what struck me in this research that you all have done is that our children, our drug endangered children, are expressing that they feel, because of their context, that they have to become more invisible, that they want to be seen less, that they don't want to stand out, that they
Mm,
and the it just seemed like there is such um, a substantive need for the systems in which we're connected with to look at how do we help. I think I can't remember whether it was you or Jennifer, but the role that the systems can play in acknowledging their trauma, acknowledging where they
mhm.
are kind of in this, having them feel seen and valued is one of the things in which we are able to, I think, play a role in this. It was just the whole conversation
Yeah.
around protective factors that it really struck me as being something that could be vitally important for us.
Yeah, I totally agree. And, I think as a community, communities should push for trauma-informed schools and other systems, right? Because these kids are complex. They're going through a lot. They're presenting and kind of crying out really in different ways. Um, and that's, if you're not informed and trained in that, it's hard to really identify the kid who's acting out and, kind of being hard to deal with. That's often a cry for help. So I think the trauma informed, there's a whole field out there on trauma informed education and teaching and everything. I think not enough schools have that. Yeah.
I just wanted to speak for a moment on some of the things I'm seeing in the chat. One noted about the DARE program no longer being available and that because it was not found to be effective. And I just want to say with that this was not meant to be an evaluation of any specific program. It was just whatever program the respondent happened to name. And in fact, I would say in general, people just noted learning about addiction, at school or through different programs that they had been a part of. And so I think that in many ways, which program it is almost less important than this idea that programming being offered in settings like schools where there's many children, that primary prevention effort is really helpful and is really validating to kids that have this going on in their world, being able to put words to what's happening in the home and being able to recognize problems. Like, you're not going to seek help for a problem you don't know exists, right? And so this process of understanding what the problem is and being able to put words to that is really the first step in that help seeking process and is extremely powerful and validating. There was another comment asking about literature and studies that have helped us identify what drug endangered children have identified as the most helpful responses from people and systems when they disclose and seek help. So there is some work that has been done around that. One of our NIH grants that we've submitted is really, I think, focused specifically on asking that more deeply. One of the things that we did ask and that we have asked in sort of other studies on issues not necessarily related to substance use, but maybe on other forms of abuse is where did you go for help and was it helpful? And if it was helpful, in what ways was it helpful? And so in that way, we're kind of allowing for a survey type response to gauging how helpful different things were. The one thing that I can say is consistent across studies, and Kim certainly might have more to say about this as well, is that interpersonal connection, and individuals allowing themselves to form interpersonal connections and really be human with kids and sort of meet them where they're at. So certainly a trauma-informed approach helps with that. I think oftentimes in some systems, there's a lot more constraints about what that's supposed to look like, and that can hinder the organic connection that I think most children crave, but really just most people crave, right? Like a real, genuine interaction. But when individuals disclose, what is also certainly true and is true from the qualitative comments is that when people do nothing, that is extremely invalidating and actually manifests in less likelihood of continuing to seek help. So whether that's from a friend who says, oh, that happens all the time, and sort of fails to validate something that doesn't feel right, or it's a larger system that is unable to connect with the child or offer additional help to the home, that there's a certain amount of discomfort and I think invalidating response that creates for the child that makes them less likely to help seek in the future, even if things get worse. It sort of serves to minimize that inner voice saying this is problematic, and can really serve to escalate violence and other unsafe things in the home.
And I
I think that's
think,
a really good. Oh,
oh, sorry.
go ahead. No, go ahead, Kim.
I was going to say, and one of the other findings here, and I see this, it doesn't matter what research topic I'm looking at, is kids talk to other kids first before they talk to an adult. They know what's going on in their friends' lives. They're trying to help them themselves, which can be, hard on their friend. But there's a whole field called bystander intervention. It's been very successful in areas of interpersonal violence. There's work called gatekeeper training, which teaches adults and kids signs of suicide and how to help. And I haven't really seen it specific to drug endangered children, but you saw all the different things these kids are dealing with. They're dealing with abuse, they're dealing with violence, they're dealing with suicidal thoughts and behaviors. And I think it's a unique and kind of other way of identifying and helping and this population of kids. So if there was more around just awareness, what are the signs that can be taught to like the larger adolescent community, could be an interesting approach.
And I do think there's so much research, even that you all have been part of, when it comes to child abuse and CSEC and all that kind of stuff specifically. But we saw with some of the data that you threw up there that nearly 40% of these drug endangered children were victims of sexual abuse too. So they're part of that poly-victimization. And in the child abuse world, that makes sense. And we're like, oh yeah, you're victimized in multiple different ways. But I don't think that we're always recognizing that substance misuse aspect is part of that poly-victimization. What other questions or thoughts is everyone having?
Were there any more in the chat that we missed? I think I saw one pop up about their own current alcohol and drug use, and we did ask about that, and it is very related. This kind of idea of the cyclical intergenerational impact of that we do see.
So I want to definitely leave it open for more questions, comments, thoughts.
I want to definitely leave it open for more questions, comments, thoughts.
Ooh, wow, that was a weird feedback thing. And Lori, I see your hand. I just want to ask Deirdre if you could move down the slides.
Deirdre, if you could move.
I'm going to mute Lori for a minute. Maybe that was what our problem was. Go ahead, Jenny.
Okay, can you hear me? Okay.
Yeah.
Okay. I was just going to say, Deirdre, if you could move to the bottom of the slides, there's a thing about the CCRC and it has our QR code. If you can see some of the other research that our research center is doing, and you are also free to reach out to us if you can think of other ways for us to disseminate this. We're trying to think of new ways to get this out. And share this information. So certainly we're going to share the slides. And I know Carrie put the PDF of our social media stuff in the chat, but if there's other things, just please know you can reach out anytime. Lori, I'm sorry for cutting you off. Please feel free to unmute.
I'm sorry for cutting you off.
Oh, that's okay. Did that happen again? Can you hear me?
I think we can hear you. I think we're good.
You can't.
I think we can hear you.
Okay. Okay. All right. I have an old computer. So, no, I was just smiling because this is the day of the month that we pay bills. And so we sit down and we look at all of our different grants and what we have done and what fund this should come from and what fund that should come from. And the reality, much like what we were already discussing, is that there are so many of the risk factors enmeshed in what happens. And so to say, oh, this is suicide prevention grant, or this is our DEC grant, or this is our drug-free communities grant, is such a challenge. But I think you're right at the middle of it, and you're in dealing with youth. We have a youth leadership program, and we do peer-to-peer suicide prevention. Somebody had mentioned Green Bandana, and Green Bandana is fabulous, but it's copyrighted, so it's only available to kids at the collegiate level. And we work to try to get Green Bandana in our schools. So we said, okay, if you say we can't have it, you don't have the copyright on peer-to-peer suicide prevention. You just have it on your curriculum. So we built our own. And we call it our bandana squad, and we use purple and teal bandanas, but take kids through the QPR training, emotional first aid training, and then they sign a confidentiality oath. But what happens is that so many of those kids are truly kids that are drug endangered, and it allows them to walk through their own personal experiences and they have that desire to not have kids be alone. And so I think that's a really powerful piece to that. We had Amy Neville in yesterday. Do you guys all know about Amy? She is the Community Anti-Drug Coalitions of America's Newsmaker of the Year. And I cannot say enough good things about the experience that we had with her. She's worked with Bloomberg, and they've created the Social Media Victims Alliance. And they have produced a documentary that is fabulous that was debuted at the National CATCA Conference. We showed that at a town hall meeting last night. There is so much entangled with what goes on with drug endangered children, trauma-informed awareness that was meshed with that. But Amy will come for free, you guys, as long as you pay her travel expenses. She will speak in your schools and your community for free. It costs $7 to show the movie, and it's the best $7 I've ever spent. So I would highly encourage you to get a hold of Amy through the Alexander Neville Foundation. And Alexander's Amy's son, who died by fentanyl poisoning. But that's just something I'd put out there to share. She went to 4 different communities, and Kansas is coming back to do 4 more. She was at a table for the Parent Project last week, where she was honored with Meghan Markle and Prince Harry. So pretty good company to be in. And my phone's been ringing off the hook today from people that were just so blown away by what they saw and heard last night.
Thank you, Lori, so much for sharing that. No, we appreciate that. And Lori had shared this up in the chat if you want to scroll up and see some of that information that she had shared.
Scroll up and see some of that information she had shared.
Great research, ladies. It just puts an exclamation point behind the importance of everything we do. Thank you.
The only other thing I wanted to add that we didn't get to talk to today, and we're just starting to look at it, is, we had a large enough group of participants who grew up in these households that we could really start looking at how they themselves may differ in terms of their experience and impact. And we do really see some distinct groups. You know, there is a whole group where the person who is struggling was a sibling. You know, and I don't think we obviously focus on caretakers a lot, and that's important. But there's a whole group where it's both caregivers. There's one where it's predominantly the mother. And then there was variability in terms of the type of drugs, right? So anything where the opiates were involved were related to much longer term impact. So I think just keeping in mind too the diversity just within this group that we're all, you know, here and caring about is going to be important.
And I appreciate how deeply Kim, Jenny, and Deirdre think about that and are like, we can go this way and use this part. And have you guys thought about this? So they've been hugely beneficial to us. And so we are so grateful for what they're studying at, and just their ongoing plans, and how we get to ride on their coattails and be part of all that to help benefit all of you through all the work you're doing throughout all your DEC alliances and all your work across the nation.
Well, and thank you so much for how much you've helped us. I mean, you helped us create the survey and all sorts of great feedback and implications. So it's been a great partnership.
Wonderful partnership for sure. Any final questions from anyone? Wasn't seeing anything else in the chat, but any final thoughts, Kim, Jenny, or Deirdre, that you'd like to share?
I'd just like to thank everybody here for what they do. You're on the ground and really actively helping these families and children. So thank you.
Agreed.
Yes, thank you all for letting us come and share this. And we're really looking forward to getting this. I think so often in our line of work, we do research and it sort of stays in the echo chamber of academia. So we're so thankful for Carrie and the rest of the National DEC team and all of you all for giving us this opportunity to share our research, and hopefully for it to make a more tangible impact and not just stay on an Excel sheet or on a slide, but really impact kids and communities. So thank you guys so much for what you do and for listening to us.
Thank you all so much for being here. We appreciate all of you in attendance today. And again, thank you, Kim, Jenny, and Deirdre. We love our partnership. We love talking with you, and you guys make it easy for us to understand the data that's not always innate to us. And so thank you so much for that. And we look forward for more work together.
Hey.
Great. Thank you so much.
Bye.
Thanks everyone for attending.
Great.